So the video is on shoulder impingement. So if you get online and you say my shoulder hurts, or what are the common reasons why my shoulder hurts, one of the things you'll see is something called impingement, right? And what impingement is if you look inside the shoulder, you look at your shoulder here, you've got this bone you feel on the very top here, it's your acromion. And then as you elevate your arm, right underneath your acromion is actually your rotator cuff, which is a group of 4 muscles: subscapularis, supraspinatus, infraspinatus, teres minor. The one that sits on the very top is the supraspinatus. And if you look mechanically at the way the shoulder works, the rotator cuff is this group of 4 muscles that stabilize the ball and socket. And as you elevate, that supraspinatus is right underneath that bone, right? And as you pull up, the deltoid muscle here pulls the shoulder socket up. And if you have weakness in the rotator cuff, or a tear in the rotator cuff, or instability in the shoulder, you can get kind of like a mechanical pinching between the humerus and the acromion. And that pinching right there, it's kind of like it's a high stress point in the shoulder, and it causes pain. So the impingement is between the humerus and the acromion, and the culprit often is that the rotator cuff is not functioning, right? And it can be not functioning because it's weak and inflamed, or because it's torn. And the way to figure that out is to get some imaging to see, what's the deal. But what you'll see is, and then we go here, we do this test here. You're taking the tuberosities, swinging it underneath the acromion. This is called the Hawkins test here, and that's kind of exacerbating the symptoms. Also, you have the near test where you're just elevating the arm above 90 and you're feeling discomfort. There's also the empty can test. We have many tests that we do in our office to try to elucidate the sign, or the feeling of impingement. And so those are our physical exam tests that we use to try to see, but often you see patients in the middle of their arm like this, and they just feel this discomfort there. That's impingement. And impingement is something that's a mechanical thing that's happening in your shoulder. The key is to find out why you're getting impingement. Is it because you have tendonitis in your rotator cuff? Is it because you have instability in your shoulder? Is it because you have a tear in your rotator cuff? And that's why you need to see a shoulder specialist, right? Or not, someone that sees a lot of shoulders and works on them all day. And so that's what impingement is. It's pinching between the humerus and the acromion because of rotator cuff dysfunction, right? That's the key, is the rotator cuff is not functioning. It's not keeping the ball stable in the socket as you elevate and move the arm through space.